So what I want to go on to now is start introducing the area and issue of suicide and self-harm amongst our young people. And this isn't just something for further education or the older secondary schools. Children as young as 5-year-old are known to start self-harm behaviours. Now, the second most common method for suicide by children is medication overdose. And we're going to hear about some of those examples in some serious case reviews after as well. The most common methodology with adults and children is that of hanging or asphyxiation in some way. But things like paracetamol for overdosing is the second most common method for death by suicide. Now, paracetamol is a substance which is hazardous to health and a foreseeable risk. So the question to throw to you in relation to your site is, do you have it listed on your risk register? And are staff trained in how to recognise and or respond to a suicide or accidental overdose, medication overdose and or suicide prevention preparedness? So if this is the first time that you're aware of such training, do follow us through the training or contact us after this course to find out more in relation to our suicide prevention training specifically for school staff. So looking at some of the issues around the suicide. So the Office for National Statistics reported in September of 2018 that growing numbers of teenagers in England and Wales die by suicide. 56 girls and women aged between 15 and 19 died by suicide in 2017. That was the highest number since records began in 1981. Now, the suicide rate amongst that group, so the 15 and 19-year-olds, is classed as 3.5 per 100,000 people. And that was also the highest on record. It was at 2.1 per 100,000 in 2010. Now, if we make some comparisons in relation to what 3.5 means. So the vast majority of suicide cases that I deal with are from the secure sector, which has 120 per 100,000 deaths. So there's a vast difference between those figures, but 3.5 is still far too many deaths of young people who potentially were avoidable deaths. And if we think about the first aid side and your preparedness and training in relation to student cardiac arrest events are less likely to be experienced than suicide, because the suicide for that age group is 3.5 per 100,000 compared to cardiac arrests, which is 0.18 100,000. So disproportionate figures in relation to those, yet the amount of time and preparedness that sites put into them is a lot for the first day. I'm not saying that that's not right, but what I'm saying is we need to focus now in relation to the suicide prevention awareness as well. Now, when we look at Keeping Children Safe in Education 2020 and their advice now in relation to mental health, all staff should be aware that mental health problems can, in some cases, be an indicator that a child has suffered or is at risk of suffering abuse, neglect, or exploitation. Staff, however, are well placed to observe children day to day and identify those whose behaviour suggests that they may be experiencing a mental health problem or be at risk of developing one. Where children have suffered abuse and neglect or other potentially traumatic adverse childhood experiences, this can have a lasting impact throughout childhood, adolescence, and into adulthood. It's key that staff are aware of how these children's experiences can impact on their mental health, behaviour, and education. If staff have a mental health concern about a child that is also a safeguarding concern, immediate action should be taken following their child protection policy and speaking to the designated safeguarding lead or their deputy. So when we start looking at some cases further in the training, we're going to have a look as well in relation to mental ill health in education sites and the issues around the self-harm and the death by suicide and what serious case reviews have brought out in relation to that. Now, when we're looking at the younger end, so here's an example in relation to, this is from 2011, and this is a 10-year-old boy diagnosed ADHD. So he was given Ritalin and Prozac in relation to his ADHD. Harry hung himself in his bedroom with his belt from his bunk bed. Now, over 700,000 prescriptions are annually dispensed for Ritalin, and children as young as 15 months old are being prescribed Ritalin. Now, if we have a look at this article, so the boy's father blames Harry's death on 2 mind-altering drugs that his son had been prescribed by a psychiatrist to cure his boisterous behaviour and low spirits. An inquest was told in April that the boy had more drugs in his body than the normal level for adults suffering from the same problems. Now, a distraught Mr. Hucknall is to make a formal complaint to the NHS for prescribing his son Ritalin, which is a cocaine-like stimulant, which paradoxically is said to calm down a child, and Prozac, a powerful antidepressant. When I was growing up, there were lots of kids like Harry, a bit overactive, a bit naughty, who didn't always do as they were told. Now they are branded with a complaint called attention deficit hyperactivity disorder, says the computer engineer. Now, one of the things that we look at throughout any child protection issue, and certainly the medication side of it, is for staff understanding some of the impacts in relation to medication and how this can put children actually at increased risk, and how it's essential that any child put on any medication is closely monitored for the next several weeks in relation to this, because it can have behaviour altering impacts. Now, in April of 2018, the University of Bristol and the death of Miss Natasha Aberhart, suicide contributed to by neglect, was the conclusion in relation to this, and the method of her death was hanging. We've also got, in July of 2020, legal proceedings launched against the university. So parents sue university for neglect after daughter's suicide. The parents of a student with severe social anxiety who took her own life the day she was due to give an oral presentation have started legal proceedings against her university, claiming that she was the victim of negligence and disability discrimination. So Natasha, a physics student, was found dead in April 2018 after she failed to attend a laboratory conference in which she was due to speak to about 50 students and staff in a lecture theatre at Bristol University. Her parents have filed a county court claim, alleging that the university fell short in its duty to take reasonable care of her well-being, health and safety. So again, these topics in relation to death by suicide are becoming increased and more prevalent in relation to our society, in relation to children and young adults. The inquest concluded in May of 2019, and the conclusion was it was suicide contributed to by neglect. The method was hanging in the bedroom. A Regulation 28 report for prevention of future deaths was issued by the coroner. At the time of her death, she was under the care of the mental health team, who had not provided a timely and detailed management plan following a number of assessments by them. The management plan should have been in place by the end of March 2018, and by the time Natasha was on her Easter holiday, which could have instilled hope and managed her risk. The NICE guideline, Depression in Adults, Recognition and Management, CG90, states in section 1.5.2.7, a person with depression started on antidepressants who is considered to present an increased suicide risk or is younger than 30 years because of the possible increased prevalence of suicidal thoughts in the early stages of antidepressant treatment for this group should normally be seen after 1 week and frequently thereafter as appropriate until the risk is no longer considered clinically important. Now, that then was a letter back in relation to the Regulation 28 report. Now, we've got more details of this case as a download for you to look at. But what we're going to go on to in our next presentation is a serious case review of child CH, which is going to bring in some issues in relation to suicide, mental health, multiple issues in relation to child protection. So we'll see you at the next presentation.